Hearing that your child needs a specialized test like a cardiac MRI, well, it can feel pretty overwhelming, and it's completely natural to have a ton of questions and concerns. But today, we're going to walk through this whole process together and hopefully turn that uncertainty into real understanding.
Okay, so you've been told your child needs a cardiac MRI. What does that actually mean? Let's dive right in. We're going to break down what this test is, why it's such a powerful tool for doctors, and, most importantly, what you and your child can expect every single step of the way.
So, let's start with the big question. Why this test? Your child might have already had other scans, like an ultrasound. So what makes an MRI so different, and why is it the right choice now? Let's take a look.
And here's the key difference. While those first tests are super valuable, a cardiac MRI is really the gold standard when doctors need the absolute clearest, most detailed information possible. Think of it like going from a regular paper map to a fully interactive 3D model of your child's heart. It's just a whole other level of detail.
All right, so let's talk about the technology itself. How does it build that incredibly clear picture of your child's heart? Understanding how it works is really the key to understanding why it's so safe and so effective.
So this is what makes the scan so special. Look at those keywords, magnetic field and radio waves. This isn't an X-ray, and it's not a CT scan. It is a totally different, non-invasive way to see inside the body.
And that fundamental difference in technology? Well, it leads us straight to probably the most important safety takeaway for any parent.
That's right. A cardiac MRI is one of the safest ways to study the heart in detail, for one simple reason. It uses zero ionizing radiation, none. It's a really powerful tool that's also remarkably gentle on the body.
And what it can show doctors is just incredible. They get a complete blueprint of your child's heart, everything from its size and shape to how well it's actually pumping. They can literally measure blood flow, check if valves are leaking, and even see how things are healing after a surgery. That level of detail is just vital for a correct diagnosis and for planning the best possible treatment.
Okay, knowing the tech is great, but what's the day of the scan actually going to be like for you and your child? Let's walk through the whole experience so you can feel prepared and confident when you go in.
The whole process, from the moment you get there, is really designed to be as smooth as possible. The care team is there to support you at every single stage, making sure your child feels comfortable and safe. And here's something to remember. The machine looks like a tunnel, but it's open on both ends and it never actually touches them.
This is a big one. It's one of the most common and important questions parents ask. The goal, remember, is to get the clearest pictures we can, and that means your child needs to stay very, very still.
So it really just depends on your child's age and, their ability to lie still for about 30 to 60 minutes. For the little ones, some light sedation helps them rest comfortably through the whole thing, and that guarantees the doctors get those high-quality images they need.
All right, let's tackle another major concern head-on. Will my child feel any pain at all during this scan?
And the answer is a clear and simple no. The procedure itself is completely painless. Now, the machine does make some loud knocking and buzzing sounds, but the team will give your child ear protection, and they're there the whole time to provide support and make it as calm as possible.
So the scan is done. What happens now? How does all of that amazing, detailed information get turned into actual answers for your child's care? Well, after the scan, a pediatric cardiologist, an expert who specializes in children's hearts, will carefully go through every single image. Within a few days, they'll put together a full report, and then you'll sit down with them in a follow-up appointment to go over everything so you have a really clear understanding of what they found. So, let's bring it all together. After all is said and done, what is the real, ultimate benefit here? Let's focus on the single biggest takeaway for your child's health and, honestly, for your peace of mind.
It really all comes down to this: 3 dimensions. The true power of a cardiac MRI is its ability to create a complete 3D picture of the heart. That gives doctors a level of insight that you just can't get with other non-invasive tests. And that's the whole point, right? A clearer, more detailed picture leads to a more precise diagnosis. And that gives doctors the confidence to make the absolute best, most effective treatment decisions for your child. It's all about replacing uncertainty with clarity.
And that's really the final thought to leave you with. This test isn't just a medical procedure. It's a powerful step toward getting answers. It's an investment in a clearer diagnosis, a more confident treatment plan, and at the end of the day, a healthier future for your child.